Welcome to Uddingston Physiotherapy. My name is Gillian Flanagan, one of the owners, along with my husband Ricky Flanagan. Just want to tell you what to expect when you come into the clinic for a treatment. When you first arrive, you'll be greeted by Jen at reception, who'll take some details from you. We need to get some personal details so we can identify you as being you. All these are kept confidential and will not be shared with any other party. You'll then be brought through with one of the therapists to the treatment room and they'll conduct an assessment. We need to take some medical history from you first. It's really important that we take these details from you. Again, everything is entirely confidential and will not be shared. It's kept in the strictest confidence and stored carefully. It's important that we know all the information about your injury. With regards to back pain in particular, which is what we see the most of, we would tend to take a history of how your back pain appeared. Was it a gradual onset? Was it a sudden onset? All these things help us to determine what type of injury has been sustained. We need to know your past medical history. This is important because it can have a big bearing on your current injury. An injury to your knee in the past could be the cause of your back pain currently. Any illness that you have can have a bearing on your ability to cope with back pain. It could have a bearing on your ability to heal. It could be part of the reason you have it in the first place. So these things are important. Your drug history, any medications that you have to take are really important as well. Are you on an antibiotic for an infection just now? That would affect our ability to treat you. Are you on pain medication that helps to kind of mask any of the symptoms that you have just now? Are you on any blood thinners that could potentially make you bruise? Any long-term steroids that could affect your joint stability? All these things are important when to know them, so please share them with us. Your social history, so your job, your lifestyle, any sports that you do, these things are really helpful for us to know. And again, it can have a big bearing on why your back pain is potentially developed, how it's going to have the chance to settle down, and any goals that you have to get back to. Do you need to get back to work? Are you self-employed? Do you want to get back to sport? Have you got kids to manage yourself? All these things are really helpful to know. Are you a smoker? Are you a drinker? So we'll take this history from you and then we will physically assess you. So we want to have a good look at your body. We want to look at your posture. Posture tells us loads. Any wasting, any poor alignment, any deformities in your joints, anything like that gives us a big clue as to what is going on in your body. We would then go through range of movement, your ability to move your body, particularly the joint that's causing you problems compared to your good side. We would then look at your power, is your muscles working properly, your sensation, all these things associated with your nerve. Sometimes with pain you can end up with loss of sensation or numbness or tingling. All these things need to be assessed as well. We would look thoroughly at your nervous system. We would then go through palpation of your joints. We would look physically at your body. We need to touch it. So we want to feel whether there's any stiffness in the joints, whether they move through their full range of movement. We want to feel for any tension in your muscles, any shortening, any weakness. We want to find these things and we need to put our hands on you to do that. That gives us lots of clues as to what's going on. We would then go through some special tests relating to that particular joint and that gives us a plan. It helps us formulate a plan of treatment for you. And that is really important to give you the best treatment and the correct treatment to make sure that we don't do something to harm you. So a treatment plan would then be formulated. We would usually start with some form of pain relief. So it's fine to exercise, but a lot of people don't exercise correctly when they're well, never mind when they're in pain. So we want to try and modify your pain. These can be done through a variety of means: massage, joint mobilisation, occasionally manipulation. We have a whole bag of tricks. We have some electrotherapy machines, acupuncture, various means to help reduce your pain before we then get you exercising, which is ultimately the best long-term fix. We would then sort out a plan that is appropriate to your level of fitness, your health, and make sure that you can exercise to whatever level is appropriate for you and make sure that we get you back to your full potential health and wellness.